Our programs offer many languages. Please visit suprememastertv.com/schedule and suprememastertv.com/GAT.
برامجنا متوفرة بالعديد من اللغات. يرجى زيارة suprememastertv.com/schedule و suprememastertv.com/GAT.
These successful surgeries demonstrate the effectiveness of combining advanced robot-assisted systems and skilled surgeons. Robotic surgery offers several benefits and aims to enhance rather than replace the expertise of surgeons. This collaboration results in better patient outcomes. Artificial intelligence, or AI, helps humankind surgery with robots. Continue watching to find out more.
Cow person loves rolling his bale of hay.
Vegan, because we want our children to follow the universal law of compassion.
Lovely viewers, my name is Camelia. The Rom Gabonese people will often greet you with a handshake and a smile. Gabon is a country nestled on the west coast of Central Africa, straddling the equator and home to lush rainforests, primal beaches, and diverse wildlife. May the light of God's guidance always be with you, bringing you peace and prosperity in His abundant blessings. Welcome to our show, Artificial Intelligence, or AI Helps Humankind, Surgery with Robots. Robotic surgery, also known as robot-assisted surgery, is an advanced surgical technique that uses a robotic system to assist a surgeon. This technologically advanced approach to surgery provides physicians with greater flexibility, precision, and control over an operation than traditional methods. The main system used in clinical surgery usually consists of a three-dimensional camera arm and a robotic arm or arms with surgical instruments. The surgeon operates the arm and surgical instruments through a computer console, and the robotic system translates the surgeon's movements into precise, scaled actions in real time, providing a higher degree of accuracy than would be possible with the hand alone. The console also provides the surgeon with a magnified, high-definition, three-dimensional view of the surgery. While the robotic system plays a crucial role, the surgeon actually remains in control. One advantage of using robots for surgery is their ability to reach areas that would otherwise be difficult. Additionally, unlike humans, a robot doesn't have hand tremors, so its surgery can be more accurate. Robotic surgery often allows for smaller incisions, potentially reducing blood loss, pain, hospitalization time, recovery time, and the risk of infection.
Being unconditional is super special. It attracts all like a magnet. But it's hard to do. Who can it be? Can you look around and see? You knew. We bet. Okay, try from now. See if you pass the test. Sure, with flying colors through.
Oh, God bless. It's you.
Now, let's take a look at the history of robot-assisted surgery. The idea first took off as part of the US military's quest to create a telepresence surgery system that would enable surgeons to perform operations from a long distance. Although the concept was first explored in the 1960s, it was not until the 1980s that surgeons truly realized its potential benefits, especially in minimally invasive surgeries. In 1985, the first surgical robot Puma 560 was used in a stereotactic operation. In 2000, the US Food and Drug Administration officially approved robotic surgery. This milestone marked a significant turning point and led to widespread clinical growth, including use in urology, gynecology, and non-cardiac thoracic surgery. During the 2000s, the use of robotic systems in surgeries significantly increased, including in cardiology, coloproctology, pulmonology, urology, gynecology, and more. Robot-assisted surgery can now be used to remove tumors, such as those caused by bladder cancer, and damaged organs, such as appendixes. The robotic tools used in this type of surgery are highly flexible, enabling them to move around organs and tumors more easily than a surgeon's arm could. Additionally, robotic instruments are able to navigate precisely through the body, making them particularly valuable for delicate surgeries such as head or neck surgery. Dr. Tislon Guy gave a speech titled "The Third Wave of Robotic Surgery: How Robotic Surgery is Shifting the Focus of Healthcare More Towards the Patient" in 2019 at a TEDx talk at Fairfield University in the United States.
A close relative of mine underwent surgery using the robot for gynecologic condition, and basically she was out of the hospital in a day and was back home in about 24 hours and was able to drive in about 4 days. Now that would not be possible without the robot, and that makes a big difference. Doctors in the past didn't really care how long it took you to recover. Now they do, because now they're listening to patients, and you're going to see more and more of this.
Vegan, sound sleeping, well feeling.
Let us pause for a brief intermission. Please stay with us here on Supreme Master Television. Welcome back to our program, Artificial Intelligence or AI Helps Humankind, Surgery with Robots on Supreme Master Television. Over the past 2 decades, robotic surgery has expanded its use in various fields, especially in 2023 with the beginning of robotic organ transplantation. Let's look at 2 notable examples. In April 2023, Spanish surgeons at the Vall-d'Hebron Hospital in Barcelona successfully performed the world's first fully robotic lung transplant. Lung transplantation is known for its complexity, and deep incisions are needed to access the organ. This robotic surgery used a 4-arm robot named Vinci to make incisions of just 8 centimeters below the sternum, while traditional lung transplant surgery requires a large incision of approximately 30 centimeters in the chest and also causes fractured ribs. The goal is to make this technology the standard for lung transplants. In the US, Dr. Adil Khan and his team at the Washington University School of Medicine achieved the first successful robotic whole liver transplant in May 2023. Dr. William Chapman, director of Washington University's Division of General Surgery, said,
Liver transplantation is the most difficult of the abdominal organs to consider for a minimally invasive approach, given the difficulty of removing a failing liver and successfully implanting the new organ. But Dr. Khan has shown that this is possible.
Applause for Dr. Adil Khan and his team. The team's expertise, built over years of robotic surgeries, enabled them to perform this complex procedure with smaller incisions and faster recovery times. The patient, a 60-year-old man with liver cancer and cirrhosis, is recovering well and has resumed normal activities, including golfing and swimming. These successful surgeries demonstrate the effectiveness of combining advanced robot-assisted systems and skilled surgeons. Robotic surgery offers several benefits and aims to enhance rather than replace the expertise of surgeons. This collaboration results in better patient outcomes.
The most powerful daily prayer for any time and before meditation, which is the order from God, and Supreme Master Ching Hai shares with us by His blessed grace.
We humbly worship, praise, thank, obey, and love God Almighty, the Most High, the greatest, for world vegan, world peace, and our soul liberation. We thank, love, praise the only Son of God, who is the ultimate Master for our salvation. We follow the teaching of all the saints and sages. We thank, love, and praise them, who are the representatives of God for our spiritual elevation.
Nowadays, robot-assisted systems are primarily used for more precise and less invasive surgeries, but in the future, the focus is expected to shift to robots having autonomy, flexibility, and the capacity to learn independently. The healthcare industry may want robots that can assist in pre-operative planning, real-time assessments, and provide immediate help and guidance during surgery, including predicting potential complications and providing real-time feedback. They should also be able to monitor the operating room, identify errors, and respond to emergencies. In the future, artificial intelligence may play a pivotal role in helping collaboration between humans and robots become more seamless. Artificial intelligence robotic systems will be able to mimic human hand movements with greater accuracy and stability, leading to reduced tissue trauma, blood loss, and post-operative pain. Surgeons will work in synergy with robots, leveraging their strength and precision, ultimately expanding the range of surgeries that can be performed safely and effectively. As we look to the future, the integration of artificial intelligence into robotic-assisted surgery holds great promise. However, ethical considerations, moral standards, and patient safety are critically important to these advancements. Our beloved Supreme Master Ching Hai began has offered insightful guidance on the development of advanced science and technology and shared with us the merits gained by medical personnel working in hospitals. Moreover, Master always reminds us to thank all medical personnel for their noble work.
If it goes together with the development, then it's easier to control. But if people just develop like AI and without any source of moral and limit control of the actions, of the consequences, then it could be not very safe.
Yes.
So wisdom has to go with love also, yes, and moral, otherwise it could be dangerous. If you own a hospital, you gain 700,000 points per year. If you work there as a doctor, you gain 500,000 points. If you work there as a nurse, you gain 300,000 points. That's regardless of vegan or not. Pharmacy owner gain 600,000 points per year. Work in a pharmacy as a pharmacist in 300,000 points. Work there as a helper, 100,000 points. These are physical merits, and it's just a good job, and good job that generates merit like any other good job. But we do it with the best intention to save people, to save the animal people, to awaken compassion in all living beings. Then that is the merit of it.
I believe that through an ethical vegan wardrobe, you can demand change in the way mainstream fashion works today, exploiting people, the planet, and the animals. Shruti Jain, vegan.
Two beautiful humpback whale people dance.
We would like to thank the surgeons who devote their time and effort to operate these advanced robotic surgery systems. We also appreciate the engineers who develop this incredible technology that offers such promise to humankind. Precious viewers, thank you for your delightful company today. Coming up next is Shining World Compassion Award recipient Jodie Whittaker, vegan, dedicated hero to animal people right after noteworthy news. Let's embrace a healthy vegan lifestyle in God's nurturing love.
Be vegan, make peace, do good deeds. Heaven Godspeed.